Hi, it's Dr. Jason Jones. Welcome to our video. Today what we're going to be showcasing is an instrument that we use that we call the percussor. The percussor is not, even though it may look like it when we show you the treatment later, a fancy massager or some sort of fancy vibrating machine. What it actually is, and you can see it right here, you can see that there's sort of this round disc and it's very, very soft to the touch. What we do with this is we take it and we put it on something like a tight muscle, a muscle spasm. We can use it on joints. It's really good for joint pain and stiffness, but it's also really good for what we call fascial restrictions. And what fascia is, it's sort of this white saran wrap covering that covers your entire body. And what happens is you get these little kinks or scars in there. Also works really good for scar tissue, or these little adhesions where the tissue is stuck together and it doesn't move smoothly, it actually is stuck. So what we're going to show you is how quickly we can increase the range of motion with someone. And what I've done is I've picked a asymptomatic patient, a patient that doesn't have any symptoms whatsoever, and they've never been to a chiropractor before. So we're going to take a look at their range of motion before and then after the treatment. So here you go. So what we're going to do now, we're going to show you how the percussor works. What we're going to do here with Joellen is we're going to lay her down on the table. We're going to check her hip range of motion and show you how far her hips move. Then we're going to take the percussor and do the treatment. And then we're going to retest her range of motion to show you the improvement that we can make in about a minute or so of treatment. All right, so what we're going to do now is we're going to go ahead and check her range of motion. We're going to bring her leg out as far as it'll go, just passively, just me stretching it here. Okay, and she's going to go maybe about 30, 35 degrees, about right there. Now on the other side, we're going to bring this one out about as far as it'll go. And she can go a little bit farther, maybe 40 degrees right there. Okay, so we're going to go ahead and we're going to treat both knees and we're going to treat the right hip. We're going to start with the left knee down at the bottom. It'll take just a few seconds here on each one. We're going to come over to the other side. And we're going to come up right to the hip. Okay, and there we go. All right, so now what we're going to do is we're going to recheck her range of motion. We're going to start on the right. Okay, and we're going to bring it out. And before she got to right about there, and she's got about another 10, 15, maybe 20 degrees extra. And remember, the left leg was actually better. And then we're going to bring it out, and she got about 40 degrees there. But then now she gets a good another 20, 25 degrees out of it right there. And then in doing that in less than about a minute's worth of treatment.